Welcome to A Healthy You. I'm Carol Alt. Did you know that your mouth can offer clues about your overall health and well-being, or that problems in your mouth can affect the rest of your body? It's true. So for the next 30 minutes, we're going to examine your mouth, your teeth, and all the bacteria that settles in there. I know it may sound a little weird to spend the entire show talking only about the mouth, but I promise that by the end, you're going to know so much more about how your body works and how to keep it healthy too. Right now, I'm joined by cancer nutrition expert Dr. Nicholas Gonzalez for a look at the mouth from the medical point of view. Dr. Gonzalez, I always come back to you because you just seem to know so much about how the body works in total. How in the health of the body does the mouth fit in?
First, the mouth is a reflection of the health of the body. Wherever you may have a health problem, it usually will be reflected in the mouth. Also, very often problems in the mouth can affect other areas. For example, dental infection can affect other organs. Gum infections, as is widely appreciated now, can affect the heart, can affect the brain, can affect the lungs. So increasingly it works both ways. Where problems in the rest of the body will be reflected in the mouth, but problems in the mouth can also cause problems elsewhere.
Cause problems?
Yes.
How does it do that?
Well, if you have abnormal bacteria, for example, in your gum, they can get into your circulation. They can end up in your heart, for example. In fact, there are some doctors, conventional researchers, who believe that some heart disease is actually related to gingivitis or periodontal disease. So increasingly, they're beginning to look at mouth infection, for example, as having not just local effects, but systemic effects.
So systemic, you mean throughout the whole body?
Correct, throughout the whole body.
So if you have a patient who has a bad tooth and they pull that tooth, that'll have repercussions throughout the body.
Yeah, too many dentists, particularly holistic dentists, are very quick to pull teeth, but there's several problems with that. First, when you pull a tooth, you're going to change the bite. That may seem like a simple thing, but you know, occlusion is very sensitive. You can change the bite 1 millimeter, and it will affect the TMJ, and then when the TMJ, which is the joint in the jaw, is affected, you can actually get movement in the skull bones. The skull bones are like tectonic plates, and when the TMJ moves and when the bite moves, those plates in the skull can start moving, can actually put pressure on the brain. So even something as casual as pulling a tooth, which is done all over the world, all over the country, can actually have very serious effects if the repercussions aren't dealt with properly.
You know, just a quick story here. I remember when Burt Reynolds had health issues, and they were saying, oh, he's got this, that, and the other thing. They were all speculating why he got so thin and so unhealthy. And he told me what had happened was he had actually been in a fight on the set, a mock fight, but got hit in the head with a chair and it knocked his jaw off. The TMJ can be a very, very serious problem for the health.
It's unquestionably the case. The TMJ is a very central area in the skull, and it's like the pivot for the rest of the skull. And when that goes off, first, you can get direct pain in the TMJ, and all kinds of nervous system activity passes within inches of the TMJ. So when that moves, you can actually get pressure on some of the cranial nerves that come out of the skull. And then, more importantly, in Burt Reynolds' case, I know he saw 30 dentists before he finally had someone who could correct it. The skull bones start moving, you can get headaches, you can get spaciness, fogginess, decreased cognitive ability, decreased memory. All these things can happen when the skull bones start moving. And that can all begin with an accident, as in Burt Reynolds' case, and I remember reading about that, or from something as simple as a dentist carelessly drilling down a tooth to, quote, fix the bite or get rid of a, quote, high spot, or pulling a tooth, which can throw the bite. Particularly the back molars are so critical for normal occlusion. You can't recklessly pull a tooth and expect not to have consequences.
Or put in a filling. If the filling's too high or too low, that again can throw off the jaw. And sometimes you can have health issues that you don't even know are coming from your mouth.
That's correct. I've had patients with chronic migraine headaches whose problem really began in the mouth. And when their bite was finally appropriately improved, the headaches went away.
Bacteria is a big issue. We did a little story on oil pulling. What do you think about oil pulling?
It gets laughed at, particularly among a lot of dentists, but I think it absolutely has a legitimate background. You know, oil pulling goes back a couple thousand years to Ayurvedic medicine. You know, Ayurvedic Indian doctors were very smart, and they, 1,000 years ago, knew a lot of health problems began in the mouth, and they developed this technique for the audience that's not familiar with it. Basically, in the morning when you get up, you take a tablespoon of some kind of oil like sesame or coconut oil and swish it around for 15 minutes before you eat, and then you spit it out into the toilet and flush it away. the thinking is that the oil actually pulls out bacteria not only from the local area in the gum, but actually draws it out from the rich circulation, the capillaries that are in the mouth, draws out those toxins, actually draws out bacteria, and then you spit it out and get rid of it.
And I'm sorry, did they do it 15 minutes because is that the time it takes for the blood to circulate through the body?
Well, it actually
15 minutes?
It will even do it more quickly.
Ah.
This is just tradition from the Ayurvedic doctors. They said 15 minutes tended to give you, I think it gives you six cleansings of the blood, and that was the thinking. So it gets multiple cleansings. And there are cases that are recorded in the Ayurvedic literature, which is legitimate scientific literature, of patients with bad infections where the infections resolve when the patients would do the oil pulling 2 or 3 times a day for an acute infection.
Interesting. So you shouldn't be laughing at oil pulling.
No, not at all. I do it.